Good morning everyone. Today we are going to discuss about a case of pediatric RIRS. I am Dr. Abdul Samad, consultant urologist. I am specialist in kidney stone diseases, prostatic problems and urinary diseases. I am working as a urologist at Medicover Hospital, Kurnool. A 5-year-old male child presented with the recurrent febrile UTIs. He consulted to so many doctors and finally he was diagnosed as having left renal pelvic calculus, which is of 15 mm size. So we thought that there is some infected system inside. We planned for left digest stenting. The patient is having narrow UVJ, even 4.5 French URS is also not possible. So we did digest stenting and sent the patient home. After 2 weeks, urine culture was done and it was treated with corresponding antibiotics until urine culture is negative. CT scan film showing left renal pelvic calculus in both axial cuts as well as coronal sections. 3-dimensional reconstruction of the CT scan showing renal calculus. After 4 weeks culture negative, we planned for left RIRS under GA under lithotomy position. First we removed the stent. You can see the edematous UVJ which is stent related. Now we are passing a guide wire into the left ureter, which is a stiff guide wire, then followed by ureteric access sheath insertion, that is 9.5 by 11.5 ureteric access sheath. You can see in the C-arm. This is the endoscopic view of the renal calculus and we are using holmium laser or lithotripsy. The kidney movement is very high as expected in children, so we did intermittent dusting rather than continuous dusting, because continuous dusting sometimes the laser may burn back and it can damage the blast shield and laser fiber also. As this is a soft stone, 0.8 joules is enough to dust the stone. Finally the stone get converted into small multiple fragments and now we are doing intermittent popcorning, because as the kidney movement is very high, if you do continuous popcorning, sometimes a laser fiber can damage the calyx and it may initiate the bleeding. So synchronous with the respiration, we did intermittent popcorning in this case. So the calculus is finally pulverized into complete dust. Precautions that you must take in pediatric RIRS is: use the smallest size possible ureteric access sheath, that is 9.5 by 11.5. Always use lowest settings. Never use high pressure irrigation. After complete pulverization of the stone, we removed flexible ureteroscope and ureteric access sheath and did ureteroscopy to check any injuries to the ureter. There are no injuries to the ureter, and you can see the dust coming from the kidney into the ureter. So this is the dust in the kidney. We did not use any digestant in this case. The patient is pain-free post-operatively. There was no signs of sepsis, no fever in this case. Thank you very much.